Hello everyone, now let us discuss about 2023 ICD 10CM coding guidelines for chapter 15 part 3. In the current session, we will be focusing on pre-existing conditions versus conditions due to pregnancy and guidelines regarding the pre-existing hypertension in pregnancy. Now coming to pre-existing conditions versus conditions due to pregnancy. Certain categories in chapter 15, they distinguish between conditions of the mother that exist prior to the pregnancy, which is nothing but pre-existing, and that those that are a direct result of pregnancy, that are pregnancy induced. Examples of conditions which can be both pre-existing and pregnancy induced are, for example, hypertension. Hypertension can be pre-existing. That is, a woman can have hypertension before she is getting pregnant. And hypertension can be pregnancy induced also. That is gestational hypertension. That is a transient hypertension that has developed during the pregnancy. Similarly, diabetes. Diabetes can also be pre-existing and pregnancy induced. So, when assigning the codes from category chapter 15, it is important to assess. Whenever we are assigning the codes, it is important to assess if a condition was pre-existing or which is pregnancy induced. Categories that do not distinguish between pre-existing and pregnancy related condition may be used for either. And if it is acceptable to use codes specifically for puerperium, whenever there is a specific code for certain condition complicating puerperium, you need to use that code only. It is acceptable to use the code specifically for puerperium with codes complicating pregnancy and childbirth if a condition arises postpartum during the delivery encounter. Now coming to pre-existing hypertension in pregnancy, the category O10. Pre-existing hypertension complicating pregnancy, childbirth and puerperium includes the codes for hypertensive heart and hypertensive chronic kidney disease. And when assigning one of the O10 codes that include hypertensive heart disease or hypertensive chronic kidney disease, it is necessary to add the secondary code from the appropriate hypertension category to specify the type of heart failure or chronic kidney disease. This is the basic guideline. All 10 will have subcategories which differentiate between unspecified pre-existing hypertension and pre-existing hypertensive heart and pre-existing hypertensive chronic kidney disease and both hypertensive heart and chronic kidney disease. And whenever we are assigning a code that include hypertensive heart disease or hypertensive chronic kidney disease, it is necessary to add the secondary code from appropriate hypertension category to specify the type of heart failure or chronic kidney disease. Here you can see hypertension can be pre-existing or pregnancy induced. The codes for pre-existing hypertension in pregnancy are given by two subcategories, O10 and O11. O11 mainly deals with pre-existing hypertension with pre-eclampsia, whereas pregnancy-induced hypertension is given by the code category O13, which is also called as gestational hypertension. Now coming to the pre-existing hypertension in pregnancy, O10 series. O10 series is further subcategorized into O10.0, which deals with pre-existing essential hypertension complicating pregnancy. O10.0, this is further expandable based upon the trimester, whether it is complicating childbirth or puerperium. So, O10.0, it deals with pre-existing essential hypertension complicating pregnancy, whereas O10.1, it deals with pre-existing hypertensive heart disease. Whenever we are coding a code from the category O10.1, additionally you need to use code from the category I11 series in order to specify the heart disease, hypertensive heart disease. Next is O10.2. It deals with pre-existing hypertensive chronic kidney disease. And whenever we are coding a code from category O10.2, you must additionally use diagnosis from I12 series in order to indicate type of chronic kidney disease. Next, O10.3, it deals with pre-existing hypertensive heart and chronic kidney disease. And whenever we are coding a code from category O10.3, additionally you need to code from category I13 in order to specify the type of heart disease and chronic kidney disease, hypertensive heart disease and chronic kidney disease. Next is O10.4. It deals with pre-existing secondary hypertension. Pre-existing secondary hypertension in pregnancy. O10.4 deals with pre-existing secondary hypertension in pregnancy. All the cases, they are in pregnancy cases only. Next, finally, O10.9. It deals with unspecified pre-existing hypertension in pregnancy. And whenever we are coding a category from O10.4 series, you need to use additional code from category I15 in order to specify the type of secondary hypertension. Now here you can see the individual codes. O10.011. It deals with pre-existing essential hypertension complicating pregnancy first trimester. Here 1, 2, 3, 4, 5, 6. The sixth character 1 indicates first trimester. Sixth character 2 indicates second trimester. Sixth character 3 indicates third trimester. And sixth character 9 indicates unspecified trimester. Whereas O10.02 is the code for pre-existing essential hypertension complicating childbirth. And O10.03 is the pre-existing essential hypertension complicating puerperium. The fourth character is 0 in all cases, and fourth character 0, O10.0 indicates pre-existing essential hypertension complicating pregnancy. As we have discussed earlier, whenever we are coding a pre-existing hypertension with heart involvement or kidney involvement or both heart and kidney involvement, in addition to the O10 series, O10.1, 2 or 3 series, you need to use additional codes from the category either I11 or I12 or I13. I11 indicates heart involvement, I12 indicates kidney involvement, and I13 indicates both heart and kidney involvement. Now coming to the codes for pre-existing hypertensive heart disease in pregnancy. The codes for pre-existing hypertensive heart disease. O10.111. It deals with pre-existing hypertensive heart disease complicating pregnancy first trimester. O10.12 deals with pre-existing hypertensive heart disease complicating pregnancy second trimester. O10.113. It indicates pre-existing hypertensive heart disease complicating pregnancy in third trimester. And 19 or 10.119 indicates pre-existing hypertensive heart disease complicating pregnancy unspecified trimester. Finally, O10.12 indicates pre-existing hypertensive heart disease complicating childbirth, and O10.13 indicates pre-existing hypertensive heart disease complicating puerperium. And whenever we are using codes from these category, these final codes O10.111, 112, 113, 119, 12 or 113, 13, you need to use additional code from the category I11 to identify the type of hypertensive heart. Now coming to the hypertensive heart codes. I11. Whenever hypertensive heart is associated with heart failure, you need to use I11.0. Whenever we are coding I11.0, you need to use additional code to identify the type of heart failure from the subcategory I50. Next, I11.9 must be indicated for hypertensive heart without heart failure. And whenever the patient is suffering from the conditions which come under I51.4 to I51.7, I51.89 and I51.9. In all these conditions, you need to code I11.9. That is hypertensive heart without heart failure. Now coming to next, pre-existing hypertensive chronic kidney disease in pregnancy. It is given by the codes O10.211. Indicates pre-existing hypertensive chronic kidney disease complicating pregnancy first trimester. O10.212 indicates pre-existing hypertensive chronic kidney disease complicating pregnancy second trimester. O10.213 indicates pre-existing hypertensive chronic kidney disease complicating pregnancy third trimester. 219 indicates unspecified trimester. Whereas O10.22 indicates pre-existing hypertensive chronic kidney disease complicating childbirth. Whereas 23 indicates O10.23 indicates pre-existing hypertensive chronic kidney disease complicating puerperium. And whenever we are coding these following codes O10.2112, O10.23, we need to use additional code from the category I12 to identify the type of hypertensive chronic kidney disease. Various codes of I12 series, which is nothing but hypertensive chronic kidney disease, are, it can be either I12.0 or I12.9. I12.0 is used for hypertensive chronic kidney disease with stage 5 or end stage renal disease, ESRD. Whenever we are coding I12.0, you need to use additional code to identify the stage of chronic kidney disease. It can be N18.5 or N18.6. For stage 5 and end stage, you need to use I12.0. And from stage 1 to 4 or unspecified CKD, I12.9 is used. I12.9 indicates hypertensive chronic kidney disease with stage 1 through 4 chronic kidney disease or unspecified chronic kidney disease. For hypertensive CKD NOS and hypertensive renal disease NOS, the code is I12.9 only. And whenever we are coding I12.9, you need to use additional code from the category N18.1 to N18.4 or N18.9 in order to indicate stage of CKD or unspecified stage. Now coming to the next category, pre-existing hypertensive heart and chronic kidney disease complicating pregnancy. It is given by the series code O10.311. It indicates pre-existing hypertensive heart and chronic kidney disease complicating pregnancy first trimester. The sixth character 1, 2, 3, 4, 5, 6. Sixth character 1 indicates first trimester, 2 indicates second trimester, 3 indicates third trimester, 9 indicates unspecified trimester. Whereas the fifth character 2 indicates complicating childbirth. Fifth character 3 indicates complicating puerperium. This is common for all O10 series. So O10.32 indicates pre-existing hypertensive heart and chronic kidney disease complicating childbirth, and O10.33 indicates pre-existing hypertensive heart and chronic kidney disease complicating puerperium. Whenever we are coding these following codes O10.3112, O10.33, you need to use additional code from the category I13 to identify the type of hypertensive heart and chronic kidney disease. So, and whenever we are using I13 series, you need to use additional code to identify the type of heart failure if present and stage of CKD. I13 series are categorized based on with heart failure or without heart failure, hypertensive heart and chronic kidney disease with heart failure, and hypertensive heart and chronic kidney disease without heart failure. The codes of with heart failure, hypertensive heart and chronic kidney disease with heart failure, they are again subcategorized based on stage of CKD. From stage 1 to 4 and unspecified CKD, the code is I13.0. In addition to I13.0, you need to use code from I50 series to indicate heart failure and N18 series to indicate stage of CKD. Next, hypertensive heart and CKD with heart failure with the stage 5 or end stage renal disease, ESRD. The code is I13.2. So with heart failure means I13.0 must be given from stage 1 through 4 or unspecified stage, and I13.2 is the final code for hypertensive heart and chronic kidney disease with CKD stage 5 or end stage renal renal disease, ESRD. Next, coming to hypertensive heart and chronic kidney disease codes without heart failure. Without heart failure codes are again categorized based upon the stage of CKD. From stage 1 to 4 and unspecified CKD, the code is I13.10. I13.10 indicates hypertensive heart and chronic kidney disease without heart failure. And CKD can be stage 1, 2, 3 or 4 or unspecified. In all these cases, the code is I13.0. Whenever the CKD is stage 5 or stage 6, which is nothing but end stage renal disease, the code is I13.11. And whenever we are coding I13 series, you need to use additional code to identify heart failure if present and stage of CKD. So whenever we are coding O10.3 series, you need to use additionally I13, and whenever we are coding I13, you need to use additionally type of heart failure and CKD stages. Now coming to codes for pre-existing secondary hypertension in pregnancy, that is given by the subcategory O10.4. O10.411 indicates pre-existing secondary hypertension complicating pregnancy first trimester. 412 indicates pre-existing secondary hypertension complicating pregnancy second trimester. O10.413 indicates pre-existing secondary hypertension complicating pregnancy third trimester. And O10.419 indicates pre-existing secondary hypertension complicating pregnancy unspecified trimester. O10.42 indicates pre-existing secondary hypertension complicating childbirth, and O10.43 indicates pre-existing secondary hypertension complicating puerperium. And whenever we are coding the codes from O10.411 to O10.43, you need to use additional code from category I15 to identify the type of secondary hypertension. Now coming to unspecified pre-existing hypertension in pregnancy, O10.911 to O10.93. O10.911 indicates unspecified pre-existing hypertension. It is unspecified whether it is essential or hypertensive heart or chronic kidney disease or both. Unspecified pre-existing essential hypertension complicating pregnancy first trimester. And O10.912 indicates unspecified pre-existing hypertension complicating pregnancy second trimester. O10.913 indicates unspecified pre-existing hypertension complicating pregnancy third trimester. 919 indicates unspecified trimester. 92 O10.92 indicates unspecified pre-existing hypertension complicating childbirth, and O10.93 indicates unspecified pre-existing hypertension complicating the puerperium. Now coming to the next category, that is O11, pre-existing hypertension with pre-eclampsia in pregnancy. What is pre-eclampsia? Excessive weight gain, elevated BP, swelling of hands and feet, elevated albumin and creatinine urine. Whenever this condition is seen during pregnancy, it is called as pre-eclampsia. And hypertension, pre-existing hypertension whenever associated with pre-eclampsia, it is given by the code O11 series. O11.1 indicates pre-existing hypertension with preeclampsia first trimester. O11.2 indicates pre-existing hypertension with preeclampsia second trimester. O11.3 indicates third trimester. O11.4 indicates pre-existing hypertension with preeclampsia complicating childbirth. O11.5 indicates pre-existing hypertension with preeclampsia complicating the puerperium. And finally, O11.9 indicates pre-existing hypertension with preeclampsia unspecified trimester. Now coming to the final category, gestational hypertension or pregnancy-induced hypertension without significant proteinuria, or transient hypertension in pregnancy, or simply gestational hypertension. The codes are O13. O13.1 indicates gestational hypertension without significant proteinuria first trimester. O13.2 indicates gestational hypertension without significant proteinuria second trimester. O13.3 indicates gestational hypertension without significant proteinuria third trimester. O13.4 indicates gestational hypertension without significant proteinuria complicating childbirth. O13.5 indicates gestational hypertension without significant proteinuria complicating puerperium. And finally, O13.9 indicates gestational hypertension without significant proteinuria, unspecified trimester. Now let us see some examples. A 28-year-old pregnant woman in 25th week. In her 25th week presents with gestational hypertension, no other complaints. Here the patient is in second trimester, that is 25th week, and she is suffering from gestational hypertension. The code is O13.2, gestational hypertension without significant proteinuria, second trimester. Additionally, Z3A.25 to indicate 25 weeks of gestation of pregnancy. Next example, a 33-year-old pregnant woman in her 15th week presents with pre-existing essential hypertension. Here the hypertension is pre-existing and the patient is in her second trimester. The code is O10.012, pre-existing essential hypertension complicating pregnancy, second trimester. Additionally, Z3A.15, 15 weeks of gestation of pregnancy. Now coming to next example, a 37-year-old pregnant woman in her 29th week with hypertensive heart and cardiomegaly presents for routine prenatal visit. Here the age is greater than 35 years. So it is a high risk pregnancy. The first code or PDX must be from the category O09. O09.523. Supervision of elderly multigravida third trimester. 29 weeks means third trimester. From 28th week onwards till delivery it is third trimester. And patient is suffering with hypertensive heart and cardiomegaly. Hypertensive heart without heart failure. The condition is cardiomegaly. So the code is O10.113, pre-existing hypertensive heart disease complicating pregnancy, third trimester. Additionally, O99.413. If you see O99 series in the tabular list, you will find the O10 series in excludes 2. Excludes 2 indicates they are not related but they can be coded together. Excludes 1 means they can never be coded together. When you see under O99, you can find O10 series in excludes 2. That is, you can use both codes together. So additionally, O99.413 to indicate cardiomegaly. Here we are giving this code to indicate the cardiomegaly. Diseases of circulatory system complicating pregnancy, third trimester. Under this you will find the note diseases of circulatory system that come under I002, I99. So I51.7 comes under that. That is why we are coding additionally O99.413, diseases of circulatory system complicating pregnancy, third trimester. Then hypertensive heart without heart failure, I11.9. Whenever you are coding a category O10.1, you need to additionally code I11.9. I11.9, hypertensive heart without heart failure. And when we see under I11, we need to code I11.9 whenever the conditions are classified from I51.4 to I51.7, I51.89 and so on. So here I51.7 comes under that. I51.7 is nothing but cardiomegaly. Additionally, weeks of gestation, Z3A.29, 29 weeks gestation of pregnancy. So these many codes must be given for this particular exam. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.